So, assess IV site for presence of inflammation or infiltration. Put on clean gloves. Clean the access port of the medication lock with antimicrobial swab. Stabilize the port with your non-dominant hand and insert the syringe or needleless access device of normal saline into the access port. Release the clamp on the extension tubing of the medication lock. Aspirate gently and check for blood return.
Okay.
Gently flush with normal saline by pushing slowly on the syringe plunger. Observe the insertion site while inserting the saline. Remove syringe.
So here you're going to ask the patient, is he having any discomfort? You may feel at the end of the catheter, you may feel cool. It's the coolness of the saline going in. It doesn't necessarily mean that that's infiltrating. But you look for any swelling that may occur or any patient discomfort.
What is the purpose of aspirating it a little?
To get a blood return.
Okay.
And if you get a blood return, you can be pretty sure it's in the vein.
Okay.
That doesn't mean there isn't still going to be a leak. Sometimes if it's been in a while, it may still leak. And if it starts to leak and infiltrate, you don't want to push a med in there.
Okay.
Because you don't want the med to get into the tissues. All right. So, but you always check for a blood return. But sometimes if it's been in a while, you may not get a blood return. It doesn't mean it's not in the vessel.
Okay.
So that's why you do both.
So then after you push in that first saline, then you look to see if there is any infiltration.
Right. Right. And kind of as you're going, make sure you're not starting to see anything puffing up there. Okay, so we'll push all
And
that
then
in.
Yeah, and then after that, you remove the syringe and then insert another syringe or needleless access device with medication into the port and gently inject medication using a watch to verify correct administration rate.
Okay, so I would take off the end here.
And it says, do not force the injection if resistance is felt.
Right. Now I've seen some people when they go to do the flush. If you haven't had any resistance with the flush, you're probably not going to have it with the medication. But sometimes I've seen people come, and this doesn't flush very easily, and then they're like, all their might, they're trying to push it. This isn't a good idea, because the reason it's not flushing is because there's probably a little clot at the end. So you don't want to release and push that clot up into the circulation, okay? And the venous system is going to go through the heart and up into the lungs. It's not a good idea to do that. So if you end up having to restart the IV, you have to restart the IV, okay?
So there's a blood clot, so you have to put the insertion site somewhere else?
Yeah, you have to start the IV in a different place, right? If this one's clotted off. So, oops, I put that back on again. So, you put that in, and you'll deliver this at the rate you've determined.
Using your watch.
Lots of times it's easier to take your watch off so you can hold it right together with, so as you watch how fast you're doing it.
Doesn't it usually go by the lines? Isn't that what it is? Like 10 lines per
Yeah,
or
if
something?
you get a sense like, depending upon the syringe is how many lines there are to the CC. So every syringe is a little bit different. But you will have determined that, so you'll be going with how fast you determine it. So when all of that is pushed in, then you
Remove the medication syringe from the port. Stabilize the port with your non-dominant hand and insert the syringe or needleless access device of normal saline into the port.
So I would take a separate normal saline that I brought with me.
Are those usually just available in stock, just saline
Most
syringes?
places that I've worked, they are. There's just like a whole drawer full of them, a couple drawers full of them, and
They're
so
all
you just
sterile.
grab a couple. Tri-City, I'm not sure of if you're going to have to draw them up ahead of time or not.
Gently flush with normal saline by pushing slowly on the syringe plunger. If medication lock is capped with positive pressure valve device, remove syringe and then clamp the IV tubing.
So then I would just take it off and clamp it. And if it isn't a pressurized one, you would, does it tell you there?
Yeah, it says
Clamp it first.
alternately to gain positive pressure. If positive pressure valve device is not present, clamp the IV tubing as you are still flushing the last of the saline into
Last
the
the
medication.
saline in, that means you just clamp it. And if you're not sure, it's easier to do it that way. It's pretty easy. You don't need 3 hands or anything. You just reach down to do it. Okay, so that's all.
Do you put
in.
needleless devices in sharps containers still?
Yeah, most people do. Yeah. Because you don't want to just, throw it in the regular trash. Okay? So that's really the main difference between the two.